Support of her amendment.
Thank you, Madam Chair. My amendment makes technical adjustments to this bipartisan bill, which I introduced alongside Congresswoman Miller Meeks. When necessary clinical care is determined for a child by medical professionals, there should be no reason that administrative burdens get in the way. The Accelerating Kids Access to Care Act is designed to cut through red tape and get kids the appropriate care and often life-saving care that they need. To express the importance of getting this legislation over the finish line, I'd like to highlight a story from a patient who was negatively impacted by the burdensome and time-consuming Medicaid provider screening and enrollment process. Almost 3 years ago, a baby, and I'll call her Lily, was born in a rural state with her esophagus in 2 separate segments and connected abnormally to the windpipe. Because this condition requires a particularly complicated procedure to correct it, doctors explained to the family there are only 2 places in the country where it could be done. One of them was Boston Children's Hospital in my home state of Massachusetts. Immediately, Lily and her parents were ready to travel to Boston, where the surgeons were standing by to perform the life-saving operation. But instead, Lily, who is a Medicaid recipient, was waiting for her home state to enroll the 8 providers at Boston Children's who needed to perform this complex surgery. Her state, confused about the rules concerning out-of-state provider enrollment, wouldn't authorize the services provided by Boston Children's. Lily's surgery was rescheduled more than 3 times and delayed over 7 months. As Lily waited, she lived with a floppy airway that could have collapsed at any moment, a weakened immune system, and routine breathing difficulties. This situation was not just a delay in paperwork, it was a delay that put a child's life at significant risk. Every day that passed was a day where her condition could have taken a fatal turn, and Lily's story is one of many across our country. That's why it is crucial for us to pass the Accelerating Kids Access to Care Act. The stakes are simply too high to allow bureaucratic hurdles to stand in the way of urgent medical care for our most vulnerable children. When care is delayed for kids with complex medical issues who need to cross over state lines, the consequences are severe and far-reaching. Delays in accessing appropriate care can lead to increased mortality rates and worsened health outcomes for pediatric patients. Additionally, families face significant financial and psychological strain when care is delayed. These delays also contribute to increased use of emergency services and high overall health care costs. I want to thank my colleague, Congresswoman Miller Meeks, for working with me on this important legislation, and I strongly urge my colleagues on this committee to support the Accelerating Kids Access to Care Act today so that we can ensure that no child on Medicaid has to endure unnecessary delays in receiving critical medical care across state lines. Thank you, Madam Chair. I yield back.
Gentlelady yields back. For what purpose does Mr. Carter seek recognition?
Madam Chair, I move the strike